When it comes to diabetes and your health, your face might be revealing more than you realize. Subtle changes could be early warnings of something serious, yet most people overlook them. If you have noticed certain shifts in your appearance, don't ignore them. They could be signs of an underlying issue that needs attention right now. Number 1. Xanthelasma. Have you noticed yellowish, waxy bumps forming near your eyelids? They may seem like harmless fat deposits, but these bumps could be xanthelasma, a serious warning sign that your blood sugar and cholesterol levels are dangerously high. When diabetes causes insulin resistance, your body struggles to break down fats, leading to high LDL, bad cholesterol, and triglycerides. These excess fats accumulate under the skin, forming visible fatty deposits around the eyes. The best way to prevent and treat xanthelasma is to control blood sugar and lower cholesterol. Eat a low-glycemic, heart-healthy diet, exercise 30 to 45 minutes daily, and aim to lose 5 to 10% of body weight if necessary. Metformin 500 to 1,000 milligrams twice daily improves insulin sensitivity, while atorvastatin 10 to 40 milligrams daily or fenofibrate 160 milligrams daily helps lower cholesterol levels. For cosmetic removal, doctors may use laser therapy, chemical peels, or cryotherapy. If these bumps appear suddenly or grow in size, don't wait. Get a blood sugar and cholesterol test immediately. Ignoring this sign could put you at risk for heart disease, stroke, or worsening diabetes complications. Number 2. Acanthosis nigricans. You look in the mirror and notice dark, velvety patches on your cheeks, forehead, or eyelids. You try scrubbing, but they won't go away. That's because it's not dirt. It could be acanthosis process insulin. Excess levels trigger abnormal skin growth, leading to thickened, discolored patches. Chronic inflammation from high blood sugar worsens this condition, making the skin darker and more pronounced over time. To reverse acanthosis nigricans, controlling blood sugar is essential. Metformin 500 to 1,000 milligrams twice daily helps improve insulin sensitivity, while inositol 2,000 to 4,000 milligrams daily aids in glucose metabolism. Skin treatments like tretinoin 0.05% apply at night, or hydroquinone 4% twice daily for 8 to 12 weeks can fade discoloration. Exfoliating with lactic acid, vitamin C serums, and proper hydration can also improve skin texture. If dark patches appear suddenly or spread rapidly, don't ignore them. Get a blood sugar test immediately, as early action can prevent diabetes complications. Dark patches aren't the only thing your skin can reveal about your blood sugar. If you've noticed yellowish bumps around your eyes, this next sign could be even more concerning. Number 3. Facial puffiness. You wake up, look in the mirror, and your face looks puffy and swollen again. At first, you think it's from a salty meal or poor sleep. But what if it's something more? Persistent facial swelling could be a hidden warning sign of diabetes. High blood sugar causes fluid retention and inflammation, leading to morning facial puffiness that may take hours to go away. Insulin resistance damages blood vessels, slowing circulation and making it harder for your body to drain excess fluid. To reduce facial swelling, controlling blood sugar is crucial. Eat a low-glycemic diet, cut back on salty foods, and exercise for 30 to 45 minutes daily to improve circulation. Metformin 500 to 1,000 milligrams twice daily helps regulate blood sugar, while spironolactone 25 to 50 milligrams daily can reduce fluid retention. Staying hydrated with at least 8 to 10 glasses of water daily, getting quality sleep, and using cold compresses or facial massages can also help. If facial puffiness persists or worsens, don't dismiss it. Get a blood sugar test immediately. Ignoring this could mean missing early warning signs of diabetes-related kidney or heart problems. Number 4. Dark circles under eyes. No matter how much sleep you get, you wake up looking exhausted, with dark circles under your eyes. You blame stress or poor rest, But what if the real culprit is diabetes? High blood sugar weakens blood vessels, causing poor circulation and blood pooling under the eyes, making dark circles more noticeable. Dehydration from excessive urination can leave your eyes sunken and dry, while blood sugar spikes disrupt deep sleep, making fatigue even worse. To reduce dark circles, stabilize blood sugar, eat a low glycemic diet, stay hydrated with 8 to 10 glasses of water daily, and exercise 30 to 45 minutes daily to improve circulation. While alpha-lipoic acid, 300 to 600 milligrams daily, supports nerve and blood vessel health. Magnesium, 200 to 400 milligrams at night, can improve sleep quality. Applying caffeine-based eye creams, but if dark circles persist despite good sleep, don't ignore them. Get a blood sugar test now. Your eyes may be warning you about an underlying health issue. Dark circles aren't the only way diabetes affects your complexion. If your face often flushes red for no reason, it could be your blood vessels struggling under the pressure of high blood sugar. Number 5. Frequent redness or flushing. If your face often turns red or feels hot for no reason, it might not just be sensitivity. It could be a warning sign of diabetes. High blood sugar dilates blood vessels, making your cheeks, nose, and forehead appear red or flushed. Over time, poor circulation and nerve damage cause fragile capillaries, leading to persistent redness and irritation. To reduce facial flushing, blood sugar control is key. Eat a low glycemic, anti-inflammatory diet. Avoid sugary foods and alcohol, and exercise 30 to 45 minutes daily. If flushing is severe, aspirin, 81 milligrams daily, if prescribed, can reduce blood vessel dilation. Use gentle skincare with niacinamide and aloe vera to soothe irritation, and avoid hot showers or spicy foods, which can trigger redness. If facial redness happens frequently or worsens, get a blood sugar test. Your skin could be warning you about diabetes. Number 6. Dry, flaky skin. If your face constantly feels dry, flaky, or itchy, even after using moisturizers, it could be a warning sign of diabetes. High blood sugar draws moisture away from the skin, leaving it dehydrated, tight, and irritated. Poor circulation slows nutrient delivery, making it harder for the skin to repair itself, while chronic inflammation weakens the skin barrier, causing persistent dryness, peeling, and itchiness. Many people mistake this for seasonal dryness or sensitive skin, but if it doesn't improve, your body might be signaling blood sugar issues. To restore hydration, focus on blood sugar control, eat a low glycemic diet, drink at least 8 to 10 glasses of water daily, and exercise 30 to 45 minutes daily to improve circulation and skin health. While omega-3, 1,000 milligrams daily, and vitamin E, 400 IU daily, nourish the skin. Use fragrance-free cleansers and ceramide-based moisturizers to lock in hydration. Applying hyaluronic acid serums, aloe vera, or colloidal oatmeal can soothe irritation and support skin barrier repair. If your skin remains persistently dry or cracked despite treatment, don't ignore it. Your skin could be warning you of diabetes. Number 7. Slow to healing facial wounds. You get a small nick while shaving or pop a pimple, but weeks later, the spot is still there, red and irritated. If your wounds take forever to heal, your skin might be signaling a bigger problem. High blood sugar damages blood vessels, reducing the flow of oxygen and essential nutrients that help wounds heal. Poor circulation makes it harder for your skin to repair itself, while a weakened immune system struggles to fight off bacteria, increasing the risk of infections, persistent sores, and slow-healing acne. You may notice that scabs last longer, minor wounds become inflamed, or breakouts take weeks to fade. To speed up healing, focus on blood sugar control, eat a low-glycemic diet, eliminate processed sugars, and exercise 30 to 45 minutes daily to improve circulation. While alpha-lipoic acid, 300 to 600 milligrams daily, improves nerve function and healing speed. Vitamin C, 500 to 1,000 milligrams daily, and zinc, 30 to 50 milligrams daily, boost collagen production to repair skin faster. Treat wounds with mupirocin 2% twice daily for infections, or clotrimazole 1% twice daily for fungal sores to prevent complications. If a cut doesn't heal within 2 weeks, don't ignore it. Get a blood sugar test immediately, because slow wound healing can signal serious diabetes complications. Number 8. Increased facial hair growth, hirsutism. If you've noticed thicker or darker hair growing on your chin, jawline, or upper lip, it's not just an annoying cosmetic issue. It could be a warning sign of diabetes and insulin resistance. When insulin levels are too high, the body produces excess testosterone, leading to unwanted facial hair growth in women. This is especially common in women with polycystic ovary syndrome, a condition strongly linked to insulin resistance, which also causes irregular periods, acne, and weight gain. High blood sugar disrupts hormone balance, worsening hirsutism over time. To slow facial hair growth, controlling blood sugar and hormone levels is key. Eat a low-glycemic, high-fiber diet, exercise 30 to 60 minutes daily, and avoid processed sugars and refined carbs. Metformin, 500 to 1,000 milligrams twice daily, helps regulate insulin, while spironolactone, 50 to 100 milligrams daily, blocks testosterone receptors, reducing excess hair growth. Inositol, 2,000 to 4,000 milligrams daily, can further support hormone balance. For long-term hair removal, treatments like laser hair removal or eflornithine 13.9% cream, apply twice daily, can slow regrowth. If new facial hair appears suddenly or worsens over time, don't ignore it. Your body may be signaling serious underlying health issues. Recognizing these subtle changes early could make all the difference in protecting your health. Stay informed, stay aware, and always pay attention to what your body is trying to say. You might also want to watch this video for other subtle signs of diabetes. And please subscribe to this channel if you found this video helpful. Thank you for watching.